A former House lawmaker and 2022 senatorial candidate renews the call for government to provide free mass testing amid the latest COVID wave. For more on his recommendations, we are joined by Attorney Neri Colmenares. Good morning, Attorney Colmenares.
Good morning, Stanley. Good morning to your viewers.
Thank you for being on the program. You claim testing must be done on a large scale as we anticipate a surge in the coming days or weeks. Why do you say so?
Well, actually, even if you lock down, as long as there's no efficient free testing and even contact tracing, then that response will fail. Because if you only test, say, 30,000 people, then you got what, say, 1,000 or 3,000 COVID cases. But if you actually test 60,000 people, then you get about 6,000, 5,000 cases. Then at least you know that there are more than 2,000 to 3,000. So basically testing, I've always said before publicly, the number of COVID cases is insufficient if there is no corresponding report on the number of testing, because if the number of testing goes down, then the number of COVID cases could also go down, which is a false data, Stanley. So the recommendation is always for the government to do mass testing for free, and of course also contact tracing, and of course facilities. For example, laboratories for testing. In India, they had 21 laboratories in February of 2020 last year for COVID testing. But later on, after 6 months, they know that there is a need for mass testing, so they had 1,500 laboratories. We only have about 310 according to data in the whole Philippines, 310, and about 164 of that is private. So only 146 are government facilities. So basically, as long as government will not do free testing and contact tracing, then people will be going to work, not aware that they already have COVID. So that's very logical and very reasonable. That why should government always impose on the people every time there's a surge? I've always maintained that the incompetent COVID response of the government is actually leading all this. Why do we have 2.8 million cases? Now you're going to put the burden on the people rather than on government. President Duterte borrowed about 2.6 trillion pesos 2020. It's 2.1 trillion loans in 2021. Where did it go? Why don't you build laboratories for testing? So that's the reason why I think government, the effectiveness of government response will not be as high if there is no free testing and, of course, contact tracing.
Okay, Attorney Colmenares, do you feel that there was some sort of let up in the testing front when the cases went down and we slid to low risk last month?
Well, there was actually a negligence on the part of government even earlier than that, because they should have focused. We have been demanding free mass testing, but they've always said, no, we don't have funds. They lost the battle there when they made it not a priority. You resort to lockdown, wala man lang ayuda, wala man lang mass testing, wala man lang contact tracing, then it will always come back again and again. So I hope government will now consider mass testing, especially if. Why should you impose on workers? Metro Manila, according to data, about 9 million have been vaccinated. But according to statistics and data, there are about 13 to 14 million population Metro Manila. Calabarzon, about 2 million have not been vaccinated yet.
Still a long way to go.
Yes, still a long way to go. So why just impose level 3, level 4 restrictions when you're not doing the testing itself? And government has funds for testing. They've trillions of pesos in the budget that can be used for testing if they only want to, Stanley. But they seem to focus more on it's the burden of the people. We restrict you, do not go out, the businesses and so on, rather than also mainly on the government itself.
Okay, Attorney Colmenares, you have some numbers, 120,000 daily tests in the Philippines for screening to be effective and accurate. Now, what is the basis for the numbers and how close have we been to achieving it in the last surges? I mean, are we even close to delivering at least half of that today? So far, we've only had 18,000, more than 18,000 tests done on January. So far.
No, we haven't. We haven't been close to that. The recommendation of health experts before in 2020 was 120,000. The WHO recommendation is times 10 to 30 of the number of COVID cases. So for example, if you have 4,000 COVID cases, at least 40,000 tests, or about 100 or 80,000 tests. So we've never been there. I think that one of the highest was 72,000. 72,000.
And this was last year.
Yes. No, this year. This year
only.
Actually, that was really a false narrative there, Stanley. They said, 22,000 COVID cases today. Then I looked at the number of tests, about 70,000 tests. Then a few days later, it went down to 15,000. And everybody said, that's good. It went down to 15,000. But when I looked at the number of tests, it went down to about 45,000 tests. So it was making you feel, we're winning this war. But then actually, it was because the number of tests were down too. That's why the number of COVID cases were down. We don't know. If we only had 100,000 tests that day, maybe it would not have been 15,000. Maybe it would have been 30,000. And the COVID response would have been more effective if we are appraised of the real situation and the number of COVID cases. So there are more people, because they were not tested, going to work, going to the market, but without knowing that they already have COVID. So that's the problem with these kinds of restrictions when there is no corresponding, COVID testing. And of course, contact tracing. Contact tracing, the recommendation before was 1:37. So if I have COVID, then 37 of my contacts at least should be contact traced. But the government record has always been 1:6 and maybe 1:10. So what happened to the 20 other people I talked with who do not even know that I have COVID because they were not contact traced? That's the only reasonable demand to the government, to also fulfill your duty rather than merely impose all this burden on the people and the businesses every time there's a surge. And that's why I've always maintained this is an incompetent COVID response, because lockdown is the main solution of the government rather than a burden on the government to make sure that the science is there rather than imposition of the burden on the people.
Okay, Attorney Colmenares, one side of your proposal is mass testing, and of course the other one is free testing. Now, this year's spending plan covers a sizable amount allocated for COVID response, but is free testing part of it? And can we afford it?
No, I don't see any correlative budget for the free testing. Can we afford it? Well, if you look at India, as I mentioned, India, they have about 3,000 lab laboratories now. So can we not do that too? Can we not spend for lab tests? In India, it's 500 rupees. In New Delhi, 500 rupees is about 400 pesos, Stanley. So, I don't understand why we don't focus our budget on developing laboratories, equipments, facilities for hospitals and labs. We should do this mass testing. Every time we suggest mass testing, the government said, we don't have the funds. Mass testing doesn't mean everybody. It means the symptomatic, the persons under investigation, the person under monitoring. These people who were exposed to COVID cases, pipiliin mo yun, syempre, but it's mass in the sense that maramihan yon. Now, the question always, if you feel you have symptoms, you say, magpapatest ba ako? Mahal kasi. I mean, if that's the basis there, then I don't think government will effectively respond, especially to Omicron, when people don't have the funds or wherewithal to go to mass testing.
Yes, speaking of costs, Attorney Colmenares, while RT-PCR costs aren't as exorbitant, perhaps, as in the early days of the pandemic, it remains prohibitive. And many businesses cannot afford them, especially during an economic crunch. Now, what do you propose to bring testing costs down? A government subsidy, perhaps?
Correct. The business cannot be given that burden too, because they're also suffering. Yes, government has the main burden. And one of the ways to make it go down is to develop laboratories for testing, government laboratories. As I mentioned, 310, about 100 64 of that are private. So can you imagine there are more private laboratories than government laboratories, when in fact it should be the government's emphasis now. So they keep on harping, do the laboratories, build more laboratories. If India, we're not saying we can do the Indian model, well, 1,500 laboratories in 6 months, but at least a large substantial part should be there. If we are able to develop, say, at least 1,000 laboratories or even 800 laboratories for testing, we can afford cheaper testing rather than this expensive private testing that we're doing right now.
And perhaps aside from laboratories, some people are also asking why rapid antigen tests are not yet available in drugstores in other countries. You can just buy them off the counter. Should they?
I don't know. They should be also. I don't know. There is a circular from the DOH that says that this rapid antigen costs about, government procurement is about 462 pesos. Mm-hmm. So it's not expensive really. Mm-hmm. If the antigen test, 462 pesos is not a lot if you're thinking of doing rapid antigen. So even that, government doesn't even encourage that. That's why I've always maintained it's your incompetent COVID response that's causing the surge. So why put the burden on the people? Of course, we have responsibilities as a people. We have our own obligations. But the main burden should be on government. You have the funds. You have the expertise. You have the data. Very simple. One is until now, there is no national apps for contact tracing. If you go to Visayas or Mindanao, there is no... Mm-hmm. They have different kinds of requirements. Very simple thing like that, like a national app for contact tracing. Every time I fill up the form in the restaurant, I ask the security guard, well, where will this go? They said, oh, I don't know where it will go. So we kept on dropping that thing in the restaurant, and they don't even know how to centralize it. So really, while, as I mentioned, we have obligations as a people to also observe health protocols, it should not always be the burden on the people, on the business people. We're all suffering here, and government has more funds. And, as long as they cannot account for the nearly 5 trillion pesos they borrowed in 2020 and 2021, they don't have the right to say, we have no funds for mass testing. We don't have the funds for contact tracing, which is very easy because if you do contact trace, Stanley, you also hire people. According to statistics of the DOH itself, you pay at least 18,000 pesos per month for a contact tracer. So you already help in COVID response. You're also providing employment to people. Mm-hmm. So why spend it on pork barrel, on Parmalee, on all this NTFL cutting, intelligence fund, when the need of the people is really health right now? And that's where government should focus, especially since government used the pandemic as a reason why they're going to do loans, why they're going to borrow these huge trillions of pesos in loans, which we all are going to pay anyway, and we didn't even know where it go. And so that's why I've always stressed, where did it go? As long as you cannot account for it, as long as there's no audit of these loans, you have no right to tell the people that we don't have funds for contact tracing or mass testing.
Yes, Attorney Colmenares, sadly and lastly, there are still talks about workers shouldering the RT-PCR costs every 14 days as a prerequisite to work. Now, supposing it will be partly subsidized by the government or their employers, do you think this is fair, equitable, and even realistic? I mean, it's still expensive.
Yes. Actually, my point here is the government could have afforded free RT-PCR tests, but they dropped the ball again. So imposing it on the employers, also on the workers, that's really too much. They don't even have the funds, Stanley, to, the next day's meal and so on. And, why can India, as I always say, why can India afford a 400 or 500 peso RT-PCR test? Not here. Mm-hmm. Why does it have to be 2,000 according to the DOH? That's because the government failed to do the lab test. So why put the burden on the workers? Why put the burden on the businesses? So I really disagree with this kind of proposal because the moment the employee cannot afford RT-PCR, then either the employee goes home without any income or the employee dares to go out and, of course, spread COVID if he or she has COVID itself. So it's always government burden sana. Well, as the people, of course, have the burden also, but the government has the main burden here. And they failed here. And I disagree with any imposition on the part of government, especially since they have also an incompetent vaccine rollout in the country. They've only so far the data is 35% in the entire country. So why impose all these restrictions on the unvaccinated when it's you yourself who failed to vaccinate the people? You only rolled out March of 2021 when other countries have already started rolling out theirs earlier than that. And now you're going to say, if you're unvaccinated because of my incompetence, then I punish you. That's really unfair and unjust for the people who are subject to these impositions.
All right, that's all the time we have for now. Thank you for your insights, Attorney Colmenares. Good day.
Thank you, Stanley. Good day. Thank you.